Let's talk about PCOS diagnosis under the age of 18. So, I want to start by saying that PCOS is a condition that has both a metabolic component, so insulin resistance, and a reproductive component or a reproductive consequence. So, cysts in your ovaries, high testosterone, infertility, all of that. So, when we talk about disease, it is always important that everything is going to start with genetics. If genetically you are predisposed to diseases related to metabolism, like insulin resistance, so family members have had diabetes, high blood pressure, strokes, things like that, then your child is automatically predisposed or has a high risk or carries those genes for metabolic issues. Okay. Now, the thing that is going to turn that gene on is going to be a form of stress. In the previous video, which I'm going to link below, I talk about stress in terms of work, but there are different types of stress. Okay. So whenever I'm explaining things about PCOS, especially because I have a few teenage patients who come in for PCOS, you have to understand that from inception to the time they hit puberty, they can go through different forms of stress. They can get bullied in school, they can have anxiety, they could live in an area where there's high stress, they could be eating foods that are not compatible with their body that push them towards insulin resistance. So processed foods, high carb foods, seed oils, all of the things, those are also stressors. And so if you are taking something in that is not compatible with your body, it's going to accumulate, which is what insulin resistance is. It is an accumulation of metabolic stress in a way to a certain point where it's going to manifest as disease. And for a lot of people, this is going to manifest as disease when they become teenagers, because this is a time when your body puts you in an insulin resistant state, because you need to be insulin resistant to grow. Okay, insulin resistance is important for growth. And so during puberty, your child is developing breasts, you're getting a butt, all the different sexual characteristics, you're starting your period. Now we have to deal with estrogen, progesterone, testosterone. And if prior to that happening, you were insulin resistant, guess what? All of those things that you're genetically predisposed to will come to light. And so people always wonder, like, everything was fine until I hit puberty. And I always say, from 0 to puberty, something was happening. Either you were going through some form of mental stress, or you're going through food stress or physical stress or whatever. And again, remember, the stress can be anything. For me, for example, I am asthmatic, and my asthma got turned on at age 2 because I had 3 pneumonias back to back. That is major stress, right? And so my asthma is almost like an autoimmune asthma where I've been on medication my entire life because of that initial stress. So the stress is not always going to be work. It could be food. It could be environment. It could be illness. It doesn't matter. Stress that leads to an increase in cortisol and epinephrine, and that stress that is sustained over a period of time is not healthy. Okay, and so what will happen to people who are predisposed to some condition, then they go through stress in their, as they're growing up, and then once they hit puberty, where your body is making you become insulin resistant, you start to see the manifestation of a lot of diseases, okay? So if you have somebody who has PCOS as a teenager, it is very possible that one, they have a genetic makeup that predisposes them to insulin resistance. 2, from the time of inception, so think pregnancy. Did you have a happy pregnancy, or were you stressed during your pregnancy? I truly believe it starts from inception, okay? So from pregnancy all the way to the time that they became a teenager, did they have any stress in their life, right? And I'm not just saying little stresses, but I mean sustained stress, like bullying in school, anxiety. Did they feel safe at home? Were there people fighting at home? there are just so many different things. Were they eating healthy foods? There's so many things that could have stressed them, and that would have led to micro doses of insulin resistance, and it would just keep building up to the point where they hit puberty, and the body pushes them into the true insulin resistance that's supposed to happen so you can become a woman. Okay, menarche. And so that's when a lot of people are going to see symptoms. Some people, they don't have that issue, and then they will see it when they have a major issue, like when they go to college. And this is usually when a lot of issues again come up. Most of the time they tend to be psychiatric issues, but again, it's a period of major stress that the person was not used to. And so it's going to trigger something that has a genetic component to it. It could be work, it could be pregnancy, it could be menopause. There's so many different things, so many different forms of stress that will trigger disease. And so it's really important to understand this and understand that when I say stress, I'm not just talking about the stressors of work, but it's so many different types of stress. So when I talk about work stress, I'm talking about you trying to remove or limit the stress that you have control over. Because like in the example that I give, I didn't have control over the fact that I had pneumonia as a 2-year-old, right? There was no control. You can't control the bacteria. They're going to do what they're going to do, right? But you can control what you eat. You can control the environment that you're in. You can control the work situation, whether you decide to tolerate it or not. You have control over you as a body and where you put yourself. And once you choose to make that decision to control what you're putting yourself into, then you can decrease disease and decrease the formation of disease, or the activation of certain diseases that we tend to be predisposed to. Because let's not forget, generational trauma and all these diseases stem from our ancestors also having all of these stressors and giving it to us, and we're carrying it. And as we go through the stress, we start to activate old wounds, old traumas into our present reality. So in conclusion, control the stress that you can control, and the one that you cannot control, leave it to source or God or the universe.